welcome everyone. For those who don't know me, my name is Claudia Hawkins. I'm the director of the Global Communicable and Emerging Infectious Diseases Center here at the Robert Havey MD Institute for Global Health and a professor of medicine and infectious diseases here at Northwestern Feinberg School of Medicine. Thanks for taking the time to join us this afternoon for our latest installment of the Havey Institute for Global Health's IGH seminar series. Thank you again for being so flexible. We were supposed to be doing this in person, but we had to move to virtually for some unfortunate travel circumstances. But we're delighted that you were able to join virtually. Please take a moment to follow us on Facebook, Blue Sky, Instagram. In addition, we welcome you to become an Institute member to receive access to specialized resources and services that support research infrastructure. So today I'm thrilled to introduce our June speaker, Dr. Mark Siedner, who is an associate professor of medicine at Harvard Medical School and distinguished physician at the Medical Practice Evaluation Center at Massachusetts General Hospital and a member of the African Health Research Institute for this seminar event. Dr. Siedner is an internationally recognized infectious disease clinician investigator whose work is focused on decreasing the burden of infectious diseases on health and quality of life in sub-Saharan Africa. His primary research partnerships are at the Mbarara University of Science and Technology in Uganda, which many of you know well, and the University of KwaZulu-Natal, South Africa, where he and his collaborators conduct a mix of implementation science and clinical trials and longitudinal cohort studies to address many of the pressing public health priorities in their region. He also practices clinical infectious diseases and serves as the primary research mentor to over 35 trainees and faculty across the globe, and he's a recipient of numerous awards recognizing his high-quality research, service, and excellence in mentoring. I first met Dr. Siedner a few years ago through a research training grant that we have with Harvard, and I know we have very similar interests in research training capacity building in sub-Saharan Africa. Since then, we've connected on several occasions with my colleagues and I in Tanzania, where he's provided invaluable advice and mentorship on our HIV and aging work, as in addition to other advice. So we're really delighted to have him here today. And I'm really looking forward to your talk today on promises and pitfalls of a 20-year journey through academic global health. And I just noticed the title has slightly changed to Navigating Career in Global Health Academia, but either way, it's going to cover probably exactly what everyone is looking for, and I'm really excited to hear it. So we'll have time for questions and answers after the session, but I will turn it over to you.
Thank you so much, Claudia. It's great to be here. Thanks for the invitation, and really delighted to have a chance to interact with a group of people who I think share a lot of interest both in research and probably many challenges. And as I was thinking through this talk today, was asking myself a couple questions. One, if I was someone who is potentially starting my career in global health, what were the things that I wish I had known back when I started this work? And I'll walk through a handful of those, I think, pearls of wisdom that I really wish I had known when I started. And then towards the end, I thought maybe we could have a discussion about what the future of global health academia looks like. I think we're in a very unique moment. I'm sure everyone on this call has felt an intense amount of pressure beyond prior eras over the last 3 or 4 months. And I think we have a lot to learn from each other. So hopefully I can open up that discussion and we can think together about what the future may look like. So yeah, as mentioned, I think the goal of the next 15 or 20 minutes is really to remind myself and maybe for those who are starting their careers to think together, what are the things that I've found helpful as I began to work as someone who's really interested in trying to help improve healthcare delivery in places other than the place where I grew up. And so I think that's kind of global health in a nutshell. So I'll start with the first, I think, probably most important feature of all research, probably, but certainly global health research, which is, as far as I can tell, it's almost impossible to have a successful global health research career without people who invest in you, who take the time to teach you what they know, but also to help you navigate the extraordinary challenges I think are very unique to global health. And I've personally been a profound benefactor of mentorship. I think probably have 2 of the best mentors who've ever lived. And I'm sure that I wouldn't have made it even close to where I've come without their support and help. And so I'd say 2 things that I try to impress upon people who are entering this field and try to remind myself now as a mentor is that there really is no alternative to finding the right kinds of people who invest in you. I think it's really also important to know that those people don't have to have the same career you're going to have. Neither of my mentors, David Bangsberg on the left and Bosco Buon on the right, really studied what I study, but they both were able to help me understand how to do science through a lens of global health, through a lens of the importance of partnerships, and invest their time and their energy in me. And so I think that's just one thing that I always try to take forward to my mentees, but is probably the underlying most important feature of global health research for the junior or the growing career. The second, I think, tool that I've used and I think is again maybe critical is this idea of both being present and being a partner. And that really, these pictures here each reflect various of the thousands of challenges I think we've faced in our research and our partnerships. On the left here, actually is a somewhat very ongoing and very challenging example of the fact that many of our research teams have been victims of violence and actually carjackings in South Africa over the course of the last few years. And what became extremely clear through the course of that challenge was how little, frankly, our research mattered and how important the safety and well-being of our participants, of our staff mattered, and how we could come together and address that challenge, which was extremely hard to do, but actually ultimately involved, believe it or not, purchasing electric vehicles in South Africa, which, because there are no charging stations, have absolutely no value. But it was those kinds of, I think, creative solutions that were really needed. Here's a couple of pictures of some of the staff that we work with in Uganda and South Africa. And in each of these places, I've had the real opportunity not just to be a researcher, but to be a clinician, to be an educator. And I think those activities, in addition to the research, really helped establish long-term trusting partnerships and relationships that really have been the bedrock of most of the work that we've done. Most of the ideas that we've had have come from our patients or from the nurses at the clinic. I'd say all the good ones certainly have. And I think those kinds of long-lasting, foundational, trusting relationships really do depend on being present. On the right is another example of a challenge that we had. This is one of our clinic partnerships was actually destroyed in a flood, and the opportunity to help respond with our partners to rebuild things like clinics in these cases and really show how our work goes well beyond the grants that we write together. I think again is foundational to a lot of the work that we do. Um, the next point, I think that's really important, and I wish I could have kept this with me during my entire career, is this importance of patience and persistence. This is an example, I'm sure all of you have had these, of a time when we had submitted a study, and after about 6 months, we got some reviews from an IRB that requested us to update all of our translations because the person at the IRB committee who read them actually used a different dialect than we had used. And so we complied with that. We updated all of our translations, and then the entire IRB committee turned over. And then we resubmitted, and then we got the exact same request to go back to the prior set of translations because the person on the committee actually used the original dialect for the language that we were using. And so I think it was an example of, it was like an 18-month review process. I'm sure all of you have stories like this that you can relate to. But I think really important to realize that persistence and patience are so critical to this work. Things don't get done quickly. Important things are hard. They take a long time. Policies change, processes change, people change. And so I think just an important thing that's helped me, I think, get through some of the struggles. This goes without saying, I think probably, but a lot of these lessons probably go without saying, but I think creativity is key. This diagram is an example of a pictogram that we developed when we started to try to collect stool from our study participants. And after months of trying, we continuously got empty packages back because I think the concept really didn't make sense. So of course, what we had failed to do is really sit down and think with our kind of stakeholders and what this meant and how to do this. And so working with them, they helped us depict some diagrams and make sure that we were communicating the message properly. And so just one of, I think, probably many examples of how it's really important to think outside the box, of course, to know the populations and the people that you're working with, to understand their perspectives. And this, I think, can help get through some challenges that are otherwise sometimes difficult. This overlaps a little bit with partnerships, but I think this idea of being helpful to people, and that means doing things that you probably don't expect you're going to do. I think there's numerous cases I can remember over my 15 to 20 year work where I found myself doing activities that were so outside of what I expected as part of my global collaborative work. But those activities really helped build, I think, these reciprocally valuable partnerships, and they also showed that the goal of the work wasn't necessarily to accomplish any specific goal, but really to respond to the requests of the people in front of us. So I found myself teaching courses in areas that I honestly don't think I ever would have, because that was the need at the university at the time. I found myself really helping people with their research programs that were very different than the work that I had done. And I think that kind of idea to say, even if it's not what you intended, but to be helpful when people come and ask you for help, I think it's critically important. Um, I think a similarly and related point that I think I've taken away is this idea that when you come to a new place, there are going to be priorities that are not the same that you hold, and making sure that you are able to respond to the requests and be collaborative to people, even if it wasn't the idea that you had to begin with. I think that's really important. This is an example of us working in a remote village in Uganda where some other collaborators were having problems solving these network issues that involves their research program. Was involved in this study, and I don't really actually know that much about networking, but I learned quickly and I helped them by figuring out how we can do a better job of getting remote data collection using novel kind of mobile health devices in parts of Uganda that weren't previously available. And so again, saying yes to people, developing those relationships, really important and really critical. To contradict myself, I think also very important to say no. I think maybe all of us, and when we say no, doing so carefully and thoughtfully, but making sure that we know that not all requests for collaboration are the right ones. And I think the ones where you really need to ask yourself this question is when there are these ideas that maybe the work is not in line with your own potential ethical principles or moral principles, or it challenges you in ways that you think aren't necessarily for the best of science or the best of the community. And I think there's all kinds of global health work that goes on. There's all kinds of partnerships goes on. Some of those are profoundly valuable, and other of those are cases of what I think the old way of doing work, where people would come maybe quickly, do some work and leave. And I think understanding the history of global health, understanding the history of power imbalances between our institutions, and taking that history into the decisions that we make, I think can be very important. And so I have had to say no a few times. I'm sure all of you had, and I think that's a really important skill set to learn, and something that's very important, especially for people beginning their careers. A couple last ones here. One is I think to realize that I wish I had realized earlier on that actually most science is incremental, that it takes probably 10 or 20 years to ask the most important questions. But in the meantime, the incremental science is extremely important because one, it helps build relationships. Two, it allows you to show expertise and collect pilot data and do other things that allow you to do the bigger questions. And three, it also provides a tremendous ecosystem. Smaller projects provide a tremendous ecosystem for people starting their careers, whether those are junior global health researchers on this side of the ocean who need projects to do, or whether it's helping to build the careers of our colleagues abroad. And I think the importance of knowing that not every project is going to win a prize, and that it takes long-standing, productive relationships over decades to get to those big questions, I think is important, and a lesson that I wish I had maybe learned a little earlier. I think a really important question for people who approach us, especially coming to us asking for about careers in global health, is to really help people, and this is something I could have used probably more help with, plan for their future. And this is a picture of my daughter. We did have the opportunity to live together as a family in South Africa for a couple of years, and also in Uganda for a bit of time. And I think those periods of time, as I've reflected on earlier, were really instrumental in helping me develop the kinds of relationships and partnerships that were really critical to the long-term value of our work. But I will say that living abroad is not for everyone, and it's also not feasible for people, especially when there's the partners involved, when there's children involved, when there's other competing priorities involved. Before we know it, I think in global health careers, we're not just thinking about our children and our partners, we're also thinking about our parents or our grandparents who may be at other parts of their lives. And so I think having very open and transparent relationships and discussions with ourselves, with our partners, with the people important to us, with our partners abroad to ask what are the ways that these partnerships can be mutually beneficial, and how do we figure out ways of spending time together that make the most sense for all? And I think that it's a really important and difficult question, I think specifically for people working globally, but one that again I think is really important for younger people to confront head on as they're starting their careers. And the last, I think, uh, point I'll make here is that how important it is for us as we're developing our own careers to think about how we're also developing that of others at the same time. And so, again, I've been the profound benefactor of mentorship, and I think that mentorship taught me that much more important than my own success eventually was going to be one day turning around and asking who are the people that followed me, who are the people that I was able to work with and train. And both of my mentors have had training grants, and so it really encouraged me to do the same. And so I've had the opportunity. I'm now co-director of 3 different training grants, and I think thinking about even from the very beginning stages of your career, how are you going to be a mentor? I think many people think they're too young to be mentors. I think we're all mentors almost from the moment we become scientists in very different ways, and it can be in unique ways. It can be in skills development. It could be directly in teaching. It could be in helping people write grants. But I think making sure that as we work together, we are building ecosystems, not just for our trainees here in the United States, but our colleagues abroad where we're partnering is really critical. And so I encourage my mentees in the United States to think as you're moving and starting new projects, who are the people you're training? How are you going to train them? Is it going to be formally, informally? How do we make it more formal? How do we make sure that we are the beginning of a long-standing process, which will lead to science in the places that we're working at long after we're gone? So that's something I think, I like to really impress upon my colleagues, and I'm glad to have had the opportunity to work on. So as we think about and prepare for the future, maybe I'll shift gears for a second and maybe talk a little bit about the fact that almost all the preparation we do for the future sometimes seems futile. I'm sure everyone on this call will know what this is. This is a screenshot of course, of a new NIH policy, which essentially bars NIH grants from having foreign subcontracts. And I think if you are like me, immediately challenges almost every grant I hold, at least all the U.S. government-based grants I hold. And I think I don't think anyone could have prepared for this future. I'm not sure. Maybe some have, but I think for the most part, although there's a range of predictions about what administrative changes could have, I don't know if anyone was ready for this moment. And so I think this really gives us an opportunity. I think it's a huge challenge, but it also gives us an opportunity to stop and think: how do we move from here? How do we adapt to our current environment? Not that it wasn't challenging to begin with, and work together as honestly, a community of global health researchers to prepare for the future. And so maybe this will be a conversation more than me talking, and I'll finish here in a few minutes. But I thought maybe I'd start off with thinking about how are we at our center beginning to do this. And the first thing I think we're really trying to prioritize, because I think we hold dearly this concept that we're essentially here momentarily, and the people who come after us are really going to be how we grade ourselves and judge ourselves, when we look back. And so for now, our T32 grants, I don't know if that's the same for you, seem to be that they're going to be renewed, and so that's very reassuring. What we're doing with things like K Awards is thinking creatively about how we can maintain even the Global Health K Awards, because they almost never have foreign subcontracts. A few have a few, but those foreign subs are relatively small money, and so we are independently attempting to fund the foreign research, but making the case to the NIH that K Awards and training awards can be done fully at the prime institution, whether that institution is the United States for K23s, K08s, K01s, fine. Whether that prime institution is a global institution for K43s, the global Ks, those are the cases that we're making. And of course, we don't know yet how successful that strategy will be, but it's really going to be our main focus is to try to maintain our T grants and our K grants. And of course, as all of you are, I'm sure we're thinking outside the box. We're approaching essentially every non-government funding source we can find, and asking them many different kinds of questions about the future of research funding, whether they can co-fund things, whether they're interested in salvaging active projects, and of course, submitting new grants to think about how we can extend the work that we're doing, especially with the global focus. And then for our foreign colleagues, we're somewhat lucky in that NIH is not the only funder, of course, for global research for people that are from low and middle income countries. Many different UK-based and Sub-Saharan Africa-based organizations have training grants, and we are pursuing all of those for our foreign colleagues. Finally, for the kind of larger grants, the R1s, we have these paradigms that we're trying to follow to respond to these very confusing NIH policies, which I think, as we know, are probably going to change even more. And I think we're expecting some new global health policy announcements, depending on who you ask, maybe in the next week or the next month, certainly by September. But of course, we basically have we're trying essentially everything under the sun. So if there's a foreign prime, we're essentially saying, let's leave it alone, let's remove subcontracts. But if it's a foreign prime, it's at least on paper still allowable. If it's a U.S. prime, but there's no foreign data collection, which doesn't happen for too many of our projects, to be honest, we think about consultancies and removing subs to allow the work to continue. And then for things that, of course, are U.S. primes with foreign data collection, which is the vast majority of our grants, we're trying everything. Co-funding models. Some people are trying to move their primes to foreign locations, consultancies, and using global health organizations with U.S. based to do work abroad. I think our goal as a kind of global health community right now is to share best practices as soon as we learn that things are working or aren't working, to share those ideas together, and hopefully we can find a way forward, especially as new policies come out. I'll conclude by really just reaffirming that I think what we're doing is more important than ever. This is a modeling study I'm sure many of you have seen that was published recently in the Lancet, showing what the projections of the number of deaths that are expected if PEPFAR cuts. These were prior declines in deaths, and these are projections. And there's many of these now. I think there's at least 5 or 10 models that have been published, suggesting that we're really in for a very difficult period in terms of global fund support, PEPFAR support, and of course that extends not just to HIV, TB, malaria, but maternal child health, things like famine, global climate change, all the things that I'm sure people on this call do are definitely at risk of severe crises. And I think that really means that the work that we do, even if the funding is more challenging, is really more important than ever. So maybe just to conclude with some questions for ourselves. I don't have answers to many of these, but I think our most important question now is how do we maintain a clear and sustainable pathway for junior scientists, both here in the United States and abroad? I think if we do nothing else, I think answering this question will be so critical to the future of science and the future of the work we do. I do think that the next 6 to 24 months are the most crucial period of time. I think that there'll be new policies between now and then. I think that there'll be new funding mechanisms between now and then, but instantaneously changing funding streams, which in some cases, are in the many tens of millions of dollars from one to the other, takes time. And I think we need to figure out how to get from there to here creatively, duct tape or whatever it takes, but working together for bridge funding to get from here to that, wherever that is. Because I am someone who thinks there will be a light at the end of this tunnel. This work is too important and it's too critical to the future of the planet for it to completely evaporate. And I think, this is the challenge for those of us working collaborative global health. How do we meet this moment? How will we look back? Because I'm sure we will at this moment, 2025, and ask ourselves how to respond to this. And I think we can do it together. And I look forward to thinking with all of you about what that future may hold. So I'll stop there. More of a philosophical talk, I think, than anything empirical. But look forward to the discussions, and thank you all for your attention.
Thank you so much, Mark. There was a lot of food for thought there, and I think I was just looking through the list of our attendees, and I know I've had several conversations with people who are in very similar situations. I think how you're approaching your grants, your collaborators, communicating with them, how you're sort of thinking about the future and the approaches you're taking are very similar, I think, to many of ours. I'm sure people have questions. I think, Meg, everyone has to, is there a raise hand, or can we take people off mute, or do they have to just put their questions in the webinar chat?
We can do it all. We do have a few questions in the chat. So
okay, yeah,
Dr. Siedner, if you'd like to
those,
kick off with those, but I can also unmute everyone if we want to allow for the opportunity for a more open
I think that would be great,
Great.
because I know it's always a little tricky sort of answering questions. I know, the webinar questions are great in some situations. I think for this, I think we can trust that people will use the unmute function appropriately. And
Perfect.
and I know we can maybe we'll take Lisa's question first if you have everyone off by now. Otherwise, I can read it out. Lisa let's see if she's here. Lisa, did you want to go ahead? Are you off mute? Do you want to go ahead and ask your question? She's raised a hand, so I think we can, yeah, I think you can take yourself off mute if you can hear me. I'm assuming you can.
Thank you. I just
Yeah.
figured that out. So thanks so much. And Mark, sorry to not see you in person, but always lovely to hear from you. You know, one of the things that we've been thinking about very have is, you know, how do we advocate better with governments? Because ultimately we do this research because that's not an area that I think we've invested in. I just love to hear how do we do better at training the next generation, or even, God forbid, our generation, with government, so that we're not always just reliant on research funding, but also more embedded research, and then also knowing that the research we do has better impact.
Yeah, thanks, Lisa. And yeah, great to hear from you as well. Yeah, I think one thing I know about you, Lisa, is you always ask really hard questions. I wish that was a question. I mean, I think that you know, there's so many different challenges right now, but I think the problem that one of the major problems right now is it's really difficult to think about the future when the house is on fire. And I think that right now, what I'm seeing and hearing mostly from ministries of health in places like Uganda and South Africa is some mix of, frankly, I don't know if it's denial or, you know, this reassurance going on that things are going to be okay, that we can figure this out. And at the same time, I think on the ground, clinics are closed. You know, people aren't getting access to care in medicines, and the abrupt discontinuation of USAID. I'm not even talking about research funding now. I'm talking about programmatic funding. Has caused such chaos that it's really difficult. It's a difficult time to be asking anyone. Why can't we be doing things better? Because I think everyone's in crisis mode. But I hope, and I'm not sure that public health has the best track record for this, to be honest. But I hope that when we do emerge, and we will emerge from this very differently, I think, but we will emerge from this in some way with some new form of health system funding and some new form of models, that we will learn from this and understand that, you know, dependence on global funding in ways that we were dependent on global funding is not sustainable. That I think many have argued that one of the solutions to this problem is for increased healthcare spending in many countries. That's both for research and for programmatic activities. We've recently looked at the number of billionaires in every country in the world. There are numerous billionaires in many low and middle income countries. I think there's 300 of them in India, for example. But there's a relatively low rate of philanthropic giving in those countries for things like research and health. So I think it's a difficult moment in time to be doing anything other than questioning why we, as I think, government made a decision to make such an abrupt change to health systems that were so deleterious at once. I think a more prolonged transition would have allowed us to hopefully answer the question that you asked by thinking, how can we actually do a better job of diversifying funding, improving communication, showing the importance of, you know, health development, showing the importance of research. But at the moment, I think it's such a crisis that it's difficult. I find it difficult for most people to answer that question.
Thanks, Mark.
So, sorry, I don't have a great response to that one.
Thanks. I think the next question is from Debbie. Do you want to go ahead, Debbie Swarthout?
Yeah. Debbie Swarthout, current student at Northwestern in the Masters in Health Professions, or Health Analytics, sorry. Very interesting talk, and I like the graphic showing the funding process. I was curious about the potential to explore consultancies versus reducing subcontracts. And I was wondering if that revolves around less overhead being paid out to subcontractors and more dollars being focused on research instead. If you'd like to comment on that or clarify that, I'd appreciate it. Thank you, Mark.
Yeah, of course. So just with full disclosure, I think I don't have I don't know if any of us have enough experience yet to know what the long-term NIH strategy for global health funding will look like, or US government, I should say, and what the short term. By short term, I mean, how do we respond to this NOT that says we aren't allowed to have foreign subcontracts? Many people, and there's some major US academic institutions which have partnered NGOs which are based in the United States as 503Cs or whatever, are using those or proposing to the NIH that they are not going to have foreign subcontracts, that they're going to use these NGOs and or consultancies to pay money without a foreign subcontract to accomplish the same goals that were in the original aims. And so it's sure if it's a workaround or it's a strategic response to an NOT that forbids foreign subcontracts. I don't think it's done as a cost-saving maneuver. I think it's done as a strategic response to the inability to have foreign subcontracts. Whether the NIH has appetite for it, I don't know. I honestly don't know. I know many people have tried it. I personally am not aware of any that have been approved. Maybe you all are, but the situation is I guess confounded by the fact that almost no grants right now are being renewed, or they're being renewed extremely slowly because the NIH actually has also cut their administrative support staff to the point where it's just taking a long time for all non-competitive renewals to go through, whether or not they have foreign subcontracts. So ultimately, I think there's very little experience. And what the NIH is doing when they don't renew grants is essentially saying nothing. They're not telling people that their efforts are not functional, unlike the grant cancellations. And so I think there's just little experience, but I know many people are attempting the consultancy route as a workaround to the NOT. I hope that answers your question.
Thank you.
Yeah, that's actually super helpful. It's very interesting to hear sort of these other mechanisms being pursued. Any other questions from others? I have a couple while we're kind of waiting for folks to raise their hand. I'm just looking through here. I guess, Mark, my question is a little bit more sort of how are you advising your trainees right now in the countries that you collaborate with in Uganda and South Africa and elsewhere? I mean, those who are sort of in the process of, are really close to putting in a K-43 or some other kind of investigator award. I mean, how are you advising them? Should they go ahead? Should they start preparing? Should they just look at alternatives like Wellcome, for instance, without sort of making it sound too dire over here that you don't want them to lose trust in us completely and also, lose that collaboration. And I guess it's sort of a dance of words, I feel like, with some of, a couple of trainees who are right in that position. And of course, the question I get back is, why would I put all this work in if it's not going to go ahead? And right now, we don't really know. We don't know what's going to happen with the K-43s, for instance. And so I guess I'd love to know how you're approaching that. And particularly with the trainees, like I say, who are really those are sort of at the K-43 stage, and we know will be these brilliant physicians and investigators in the future, and really worth investing in. So,
yeah, it's a great question. So, I try to be as transparent as possible with essentially everyone I work with, and I try to start with this idea that I think everyone has a tolerance for risk in terms of what the future may hold. And I think that tolerance is determined by many things. But one of them, and I think most importantly, is things like family and who many of our foreign colleagues in particular, I think, and sometimes support entire communities of people, through the work that they do. And so I really want to be
is that
cognizant.
just me that's lost?
Oh,
sorry. I did everyone else lose? I think it's either me or lost you. Sorry, or everyone else did. I don't know.
Well, I'll back up for a second.
Yeah, back up. Just sorry.
It was just saying that being really upfront and transparent about the unknowns of the future. And so if people have obligations, financial obligations that require them, a guaranteed salary or whatever it may be, to support families, loved ones, etc., then I do say, and they wanted to write a K-43, then I do, or something equivalent, say, I don't know if that grant will be available. And so I think it really comes down to what you feel would be best for you and your family. I will unequivocally support you in your decision, no matter what it may be. And if that's to continue pursuing science, I'm here with you. If that's to do something else, how can I help you do that? Do you need letters of support? Do you need connections? How can I help you network? Just to make sure people don't feel an unintended pressure to move on in a time of complete uncertainty. For those who are committed and saying they want to do this, my current strategy has been to do something similar to the following, which is let's develop this concept. What do you want to be doing for the next 5 years? You're like, what is your research plan? What is your mentorship plan? Let's develop that concept. And since we don't know if the K-43 is active, if you're from a low and middle income country, let's go to Welcome and look for the early career awards. If you're in a country that has an MRC, is there an MRC equivalent? Let's put together an application that we think we can use for each of these different types of applications. And it turns out that a Welcome Early Career Award and a K-43 are not that different. They're actually, you can, and in fact, I've had a trainee actually use the same application for both. And actually, this was in a prior era, of course, got them both and had the difficult decision of deciding which one they wanted. So I think that my general path at this point for people at that career stage is first to make sure they don't feel undue pressure, given the climate we're in. And two, if they do want to pursue it, which I think is reasonable for people that do, I don't think we've hit a dead end here, to be as flexible as possible about the funding opportunities. And if the K-43 continues to exist, which I don't know if how many of you were at the Fogarty Center Council meeting last week, certainly sounded like it was going to continue. And it certainly sounded like the director of the NIH still supports the Fogarty Center. I'm not sure if South Africa, for example, will receive funding, but I think in most parts of the world, it sounds like the Fogarty Center and things like the K-43 will continue to exist. So let's hope that's the case, but having some flexibility in the meantime for other similar career opportunities and grant opportunities, I think is a wise alternative path.
Yep. Yeah, makes sense. Okay, I'm just going to carry on asking questions if no one else is. I guess and feel free others to just raise your hand. I know there is one other question, but I was just going to leave it to maybe after we sort of could still talk around the sort of new mechanisms that are going to be put in place. So one question I think I had, and this probably has others thinking of this too, is this new sort of direct subcontract mechanism if they do it to US to foreign sites, which obviously is going to cause a lot of extra burden on both foreign sites and the NIH, quite frankly. But I'm curious what I mean, obviously, I think it does. I think part of me thinks it may give a lot more autonomy to the sites, but to some degree. But I also think that there's a potential for sort of survival of the fittest here, and that I mean, it's like they're looking to get rid of foreign collaborators by putting this mechanism in place. And then, and then I was sort of starting to think should we be really what's the letdown is usually the research administration and the capacity for that to do it. I mean, we have great scientists who write brilliant, research and have some, really good mentors, etc. But really they're eventually, what lets them down, I've seen this with K-43s, is actually their research administration, because they don't have the capacity to be able to handle the grants, submit them timely, etc. And I wonder if we should be rethinking some of our internal awards, for instance, to be doing that instead of the science. So I'm curious your thoughts on that. But
yeah, it's a great question, and I'll say that I couldn't agree more that it's critical, and I'll say that again, this is largely something I've learned from my mentor. When my mentor first went to Embry University, there actually wasn't a grants office there, and through partnerships between MGH and MUST, the grants office was built, and we annually have conferences between our administrative staff and theirs, and they come to Boston and they learn accounting and QuickBooks and all these programs, and we go to Uganda. All of our administrators have been in Uganda. They're essentially all friends with the staffs in our office and their office, and we've spent a remarkable amount of time and resources, as have they, in building that capacity from an office that didn't exist to now one that manages tens of millions of dollars of both NIH and other grants. And I think they do so quite effectively. After very like at our grants office here in Boston doing global health, it was a steep learning curve for them too. And so I think when we think of research, and I think this is one of the reasons why partnerships, like long-standing trusting partnerships, are so important. In the decades of work, it's not just having good scientists. It is having that ecosystem. It's having training grants at both sites. It's having administrators at both sites. It's having an IRB that understands local priorities and local science and will work with you to solve really difficult ethical problems. I think all of those things are critical to the research process. And I agree with you that if there is a new policy in place that requires these direct contracts, yes, that's a challenge, but frankly, it's a huge opportunity, right? I mean, if that actually makes them all independent of us and that they can, they have that infrastructure, then I think that will be better for them because then they could actually pivot away from the NIH and pivot away from other funders and have the, the expertise to manage grants essentially everywhere. So, yeah, I echo your idea that that's important. There actually, I don't know if these will continue either. There's something called a G11 grant. I don't know if you all are familiar with that.
Yeah, we have a few. So
Yeah, those are also excellent opportunities to do administrative capacity building. And again, I'm not sure if they're going to continue or not. I hope they do. But those are the kinds of projects I think that have really helped engender these partnerships and build expertise and on both sides and learn from each other about what we each do well and how we can help each other. So we'll see. Yeah, it's really hard to know what the NIH is thinking or what they're going to do. But let's hope that this is all in good faith and that there will be a policy that's announced that allows us to continue to do this work. I think as long as there is one and it is in good faith, I do think we'll figure it out. I mean, all of you, I'm sure you've faced bigger, I mean, maybe not bigger challenges than this, but pretty large challenges. And we figured it out. We work together and we figure out new ways of doing things. And yeah, I'm confident that if it is in good faith, we will figure it out.
yeah. Chad.
Yeah, I just wanted to chime in and say thanks so much for your talk and coming and doing this. And what you were talking about was making me think big, like you said in your slides. And thinking big, is there a way that we can preserve the kind of infrastructure and stability that these federal grants and federal awards have given us? I mean, I think that's essentially what that funding has done. They're 5-year grants. They do provide a big indirect to our universities. They provide infrastructure and support to us that you can build into your projects and grants. So, and I feel like we don't see a parallel kind of similar system in the foundation or private, in the world where we're seeking private donation and when asking our rich friends in Chicago to give us money to help fund our global health research. So my question is, do you think we could create a system, a big picture system that kind of parallels that stability and long-term vision for global health through just philanthropy and foundation work?
Yeah, I mean, I think some people do that. I think I can't say our group has done that much. I think we have really been probably overly dependent on U.S. government funding. But there are other folks even here at Harvard. I think there's the Harvard Botswana Collaborative is certainly NIH funded, but it's also very highly funded by philanthropy. Of course, all of the partners in health work around the world is almost entirely funded through foundations and philanthropy. And I think the key to their success, I think, often has been this idea that they really focus on a single partnership, or they know their partners and they know their partners well, and they're not all over the map, and they have these relatively well-defined goals. They can sell that goal. Certainly, I think Paul Farmer was such a unique communicator and such an advocate that I think he stands maybe alone or with a few other people in being able to do that. But I do think that when you have a clear mission and you have long-standing dedicated partnerships, that you can make that case. And I do think that philanthropists and other foundations will buy into that. And I think that part of that is saying that we're not just here to do a research project, that we are here to develop a research community on both sides of the ocean, that we're in this for the long run, and that we need sustainable funds to do that. So I have to think that it's been successful for some. I think it's to be honest, not something that most scientists are trained to do. And I think it's something we need to learn. We need to learn to be better, as Lisa said, somewhat differently, but better communicators, better advocates for the work that we do, and learn, I think, essentially a new system of financing the work that we do. That it does not include 3 specific aims and an innovation section,
right.
Because I mean, that's how I was trained. I'm assuming that's
right.
All of you were trained, but I think we can get there, and maybe it will be the next generation who figures this out. Maybe it will be other people put into a challenging situation who say, there's a better way of doing this, and we need to pursue that and and then maybe they can teach us, or maybe we can just retire then. But either way, hopefully the landscape will be much clearer in the next year or two.
Appreciate those comments.
Yeah. Okay, so I will change tack a little bit, hopefully into some more lighter and engaging questions with a more optimistic outlook. So one attendee did ask, what is a project or job you've done where you've had a huge perspective change?
Yeah, well, yesterday I spoke a little bit to another audience, to the T32 audience, and I think that gave me an opportunity to reflect on some of the specific projects I've worked on. And I think for me, it's really been the failures, our failures that have taught me the most and really given me the most perspective. I'm not sure how many of you are on that, and maybe none, which is probably a good thing. But one of the projects I talked about was this clinical trial that we did to help improve HIV care delivery, by improving the way laboratory testing was done for people that are failing treatment. And I honestly thought this was going to be like a groundbreaking study, et cetera, and it completely failed. And it completely failed because I had failed in developing the study to think about all of the principles that I had learned about how social determinants of health affect health and healthcare delivery, and how our intervention didn't address those. And I think the good the lesson from that really changed the way I did the future of my trials. And so we've had a couple of trials since then where I do think we took those lessons to heart. And we just finished a trial in South Africa, actually, where we definitely took those lessons to heart. And we developed an intervention for chronic disease management, which definitely approached some of the challenges that the healthcare system was facing, but also directly addressed structural barriers to care, addressed poverty, addressed distance to clinic, addressed the burdens that chronic disease patients feel. And that study actually had a pretty profoundly positive impact. And so I think, for me, I think maybe the summary is remembering the principles you learn along the way. And I think whenever we're doing health research, no matter how big or small, just to keep in mind who it is that we're trying what problem we're trying to solve, and who it is that we're trying to work with. Because I think it can be tempting in science sometimes to do something fancy or innovative, but when I forgot those kind of foundational principles, it really made my science less effective. So I'm not sure if that answers your question, but maybe it's an example of that.
Yeah, I definitely think it did. So definitely appreciate that. And it was really interesting hearing that yesterday as well. We have one additional question, just due to the current administration outlook on foreign aid, how comfortable do you feel the ability of the individual countries to support, to support some of the systems in place? And I guess probably help out with the funding.
Yeah, it's a great question. I personally am not extremely optimistic of that. Many of these countries, face extraordinary debt burdens and low GDP to begin with. Many of the countries where I think most of us work have extremely low proportions of GDP spent on health. Less than 5% in many cases, much less than 5% in some. And I think it's a lot to instantaneously ask these countries to shift their financing. But I also think that desperate times do lead to desperate measures, and I think time will tell. And I hope that the future of global health delivery is a much more balanced portfolio of investments, local investments, regional investments, hopefully increase global investments as well, back to similar levels that we've seen before 2025, even if they're not increasing drastically. But I think that success will require a combination of finding efficiencies in healthcare systems, which definitely exist, and a much more balanced playing field of investments that include many different local, regional, and international sources. But I think it's a great question. Far be it for me to predict the future, but I think time will tell.
Yeah, tricky one. I agree. Great. I think if I'm just gonna pause momentarily to see if anyone else has questions. See a couple of people join, so I don't think so. Raise your hand if you do.
One last quick question.
Oh yeah.
I was really struck by the switch to electric cars to avoid the carjacking. How did you get that idea? I mean, it's such a simple thing, but like, how did you decide that would solve that issue?
Yeah, I mean, it definitely wasn't my idea. I think it
No,
was our
yeah.
chief information officer at Africa Health Research Institute, who I think honestly is car savvy and
Yeah.
was able,
Knew the market, right?
yeah, knew the market, and car thefts in South Africa are not are not uncommon, and there is clear listings of like which cars are most likely to be stolen, and there's a set of cars like the Toyotas and the Volkswagens that definitely are suffered the most of that, and yeah, they were able to I think even more impressively than figuring out was to identify a supplier and purchase them, and they've actually already been turned over, and there's a charging station now at the offices, at the research offices. So it was a brilliant idea, honestly.
Less pollution, so even better.
I mean, it solved many problems at once, I think. But yeah, I think it again shows the importance of creativity in solving problems that certainly when you start as a researcher, these aren't the kinds of things that you think you're going to be addressing, I don't think. But being there and being a partner as we're asked to solve those problems, I think goes a long way towards the success of our work.
Wonderful, thanks. Well, if there are no more questions, I think we can probably give people 8 minutes back part of their day. Thanks again, Mark, for sharing your invaluable expertise and insights today. I mean, it was really, really fantastic talk, couple of days of talks, and we've just really enjoyed having you here virtually. For those on the call, we invite you to join us at our next IGH seminar, which will be taking place on July 9th. The keynote address that day will be From Recipients to Co-Creators, Community-Driven Solutions for Public Health, Leveraging Social Innovation and Co-Creation to Address Non-Communicable Diseases in Low-Income Settings, and will be presented by Professor Renee English from Stellenbosch University. So we will send you registration for that. Thank you, everyone, for joining. I really hope you got a lot out of this session today, and I'm sure Mark would be happy to answer any questions if you have them for him after this. Yeah, thank you again. We'll see you soon.